Hi everyone, this is Jill with Om Shanti Healing. Welcome to course number 2. This course is going to be on the rotator cuff group of muscles around your shoulders. There are 4 muscles to the rotator cuff group, but before we go into that, I want to show you structurally the bony landmarks underneath the muscle so you have a visual aid once we start to do the work. This is a posterior side of the shoulder blade. There's a spine. The spine of the shoulder blade lies right here and comes up and over the shoulder joint. And this is the arm bone that comes down. So when you look at someone from the back side, this is going to be the medial edge of their shoulder blade, the bony corner, and then this will be the lateral side where their ribs are, on the outside of the rib cage, okay? Just to give you a visual aid on what the bones look like underneath the muscle. So next I want to go over the 4 muscles of the rotator group and give you just a visual on what those look like. So the 4 that we're going to be working on, and you don't need to remember anatomy or anything, muscle names, but I'm going to go over them just for visualization purposes, okay? So this is the supraspinatus. Think about the muscle when we get in there, the muscle that's sitting above the spine of the scapular bone. So this is the posterior view. Here's the spine, and that muscle is going to be sitting right above there. And this one blends in with the upper trapezius muscle, contributing to shoulder elevation and tightness around the upper part of the shoulder, going up into the neck area. Okay, the next one, just below that spine of the shoulder blade, we're going to look at the infraspinatus. This one's a little bit bigger. It covers most of the area over the scapular bone just below that spine. And you can see as we're moving through and learning that these muscles come over the joint of the shoulder socket. So I want you to remember that part because we're going to be getting into this area quite a bit to release these muscles at the tendony attachment points, okay? So this one's going to be big, and we're going to be palpating and feeling for these muscles and the edges as we go and warm the tissue up. The next one is going to be the Teres Minor. You can see this one is more on the lateral edge of that shoulder blade. And it's attached to the bone here. You're going to feel the edge of it once we palpate and get in there. And then that muscle comes up and over the shoulder socket. You see the bony nub at the top, right, of the humeral bone. It's going to be attached right to the back of it towards the bottom. And we'll feel it. And these all come together to create just one kind of hard, tight, stuck area. The subscap is this one here. So if you picture this as an anterior view, this is the front of the body looking through it. This muscle, the subscap, sits on the back side of the scapular bone and it attaches to your rib cage in the back. So this end of it is on the inside groove of your shoulder blade, okay, from the back side as you tuck your fingers up and underneath. The other side of the scapular, the subscap, attaches to the front of the shoulder socket. So it comes from the back of the body to the front of the body and attaches to the top of this humeral bone and also gets stuck to these other guys. Okay, so 4 muscles to the rotator cuff group. We're going to be addressing each of these. These 3 we're going to get from the posterior side, so my model will be face down. And then the subscap, this one, we're going to get from the front side, and he'll be face up. Okay? So, another visual aid for you. Subscap, just to give you another visual here. You see how this model is face up? There's a thumb right into that side of the ribs, and they're pushing from the lateral side of that subscap, and it's coming up to the front of the shoulder. And you see how that is? So we're going to be getting into it fairly similar to this technique that you're seeing in the picture, but I'll be getting into the edge of it from the lateral side of the body and pushing in and down and doing some movement with the arm, just so you have a visual aid of what that's going to look like. Okay? So one more picture before we get started. All of these muscles together in the body, okay? Supraspinatus, right above the spine of the shoulder blade. You see that little guy right there, okay? Infraspinatus, lighter color, this triangular patch right here. All of them meet up right in this area that causes lots of pain on folks, okay? Teres Minor is just below that muscle and deep to it. So from the lateral side, it's lower in the shoulder blade, and it's underneath that teres, or that infraspinatus. The teres is under the infraspinatus, so it's deep to that muscle. Okay, and then you can't see the subscap from this view, but we just showed you a picture of that. So we're going to start with John on face down and work this area here. And then we'll flip them over and get into the subscap from the front side. Okay, so your model can wear a t-shirt if you would like, or you can have a pillowcase over the skin like we did in course 1. And let's get started. Again, also I had mentioned in my intro to have your person on a bed or a couch, or lay them on the kitchen table somewhere that's reasonably height, for what your body alignment needs, and so you can get some downward pressure without having to scrunch up your shoulders yourself in the process. Okay, so get yourself ready and we'll see you in a moment.